Thank you very much, and good afternoon. I'm delighted to be here this afternoon to give you be given the opportunity just to say a few words about some of the work we've been doing in Glasgow. But as manager of a service where we've worked with over 700 people, I'd love to be able to tell you that what's in this report this afternoon isn't true in Glasgow. Unfortunately, it is. It's true for many of the people that we work with, and because of that, I feel that there's a very unique challenge that's presented by autism to all services. That unique challenge for a lot of services is one that is sometimes ignored, is one that's sometimes not met, but it does require many services to have a creative response. The nature of working with people with ASD means that their behaviour can often be complex, their difficulties are often pervasive, they affect all areas of an individual's life. And because of that, we need to work extra hard, we need to go that extra mile to making sure that people's services are met, people's needs are met. Mark was right in what he said earlier, it doesn't cost a lot. What people are asking for is just a little. And the cost savings, as Mark said earlier, are tremendous. The cost of running a social group is nothing compared to what it costs for someone receiving acute mental health services. One of the biggest gaps that we find is, particularly for adults, is that people are consistently falling in between the gaps of mental health services and learning disability services. This is something that really has to change. It's not acceptable for time and again people to approach services and be told, you don't meet our criteria. People with ASD have needs that need to be met, and these need to be met through the services that exist. A lot of the work we've been doing in Glasgow is around trying to make services cleverer, make them more accessible to people with ASD. I would like to think we have a brighter future though. The I Exist report sets a very good case for action. The recent government's guidelines on commissioning services for people on the spectrum are also very, very important in helping us deliver deliver on the needs for people on the spectrum. Glasgow itself has attempted to adopt a common sense approach. We're not out there to create a whole raft of new services, but what we are trying to do is make those services that are there accessible, make them available to people with autism. Scott in this video here, I mean, he was clearly going to some sort of college course when he got there and he just couldn't walk in through that door. Services need to become more accessible. They need to realise that people with ASD have needs that can be met with some common sense, not rocket science, common sense approaches. The developments in Glasgow, I suppose there's a little bit of history that needs to be said first. For those of you that do know this, in 2001 there was a national report by the Public Health Institute in Scotland. Around the same time Glasgow was working, there was a task force set up to look at the needs of families on the spectrum, and that produced its report in 2003. Both of these were catalysts for action in Glasgow. In addition to that, there was also the closure of the long-stay hospitals. So around that time there was staff developing a lot of expertise and a lot of knowledge around the needs of people on the spectrum. Predominantly those with learning disability as well, but also in some cases those at the higher end of the spectrum. But the ARC was born out of these three things. There was strong political will in Glasgow which enabled us to develop the Autism Resource Centre as it stands today. Glasgow's lucky, and for a long time has had quite strong political backing for its work in autism. As part of the council's committee structure there is a working group there are 5 elected members sit on that. And that working group has always tried its best to be a true partnership. The voluntary agencies have always sat around there as equal partners. There's been representation from all the relevant services, education, social work. But in addition, we've also had service users and parents. This group has come together to help provide an appropriate response to dealing with the issues presented by ASD. And as I said earlier, that appropriate response isn't about creating a whole raft of new services, but it is about making sure those services that are out there meet the needs of people on the spectrum. The group itself does its work on a 6-weekly basis, but also, in particular, it's set up a number of subgroups to look at some of the work and the needs of people on the spectrum. We have subgroups on criminal justice, employability, and more recently we've just set one up on housing as well. I'd like to talk a little bit as just one example of some of the work we're doing in criminal justice in a minute. But first, I'd probably just like to tell you a little bit more about the Autism Resource Centre itself, for those of you that don't know much about it. It's situated